Can a spice actually help with depression? This spice actually costs more than gold, but can it help depression? So this question was posed to me today from a patient currently taking a GLP-1 for her prediabetes and sleep apnea, and is limited by the dose because every time she goes up in the dose, depression and anxiety is set off. I actually have a few patients that have experienced this. Another one that comes to mind is a diabetic patient that does really well with a particular GLP-1, but every time the dose goes up beyond the 5 milligrams, depression and anxiety is just too terrible to bear. So this actually was brought up by the patient that's in discussion boards about GLP-1s and depression. A very good researcher patient of mine, and she posed the question about starting this spice and what did I think about it? So of course I had to dig in. So what is this spice? It's saffron. So saffron is derived from Crocus stavius. Forgive me if I'm saying it wrong. I am from the South, but I tend to screw up words myself. Don't get me started on the generic names of drugs. But anyways, the active compounds are crocin, crocetine, and saffronol. Its known actions are antioxidant and anti-inflammatory and neuromodulatory. So what does the research actually say? In randomized controlled trials and meta-analysis, saffron in a 30 milligram dose per day significantly improved mild depression. Now, it used the Hamilton Depression Rating Scale, and it showed a reduction by 30 to 40%. And it actually was comparable to SSRIs. And if you don't know what an SSRI is, those are your medications like Paxil, Prozac, Zoloft, and Lexapro. But guess what it had less of? A particular side effect that most people will come off their SSRIs. Yes, sexual side effects. So now some people appreciate those sexual side effects. Sometimes it can prolong things for people. And if you need help with that, come see me. I'll tell you all about the benefit of that medication in that area. But how does this work? It enhances serotonin signaling. It reduces neuroinflammation. It supports neuroplasticity. Now the safety with this is it was only dosed to a 28 to 30 milligram dose per day. It was not a replacement for the antidepressant. Keep that in mind. It was generally well tolerated. You had some nausea, but you'll have nausea with placebo pill. There was low blood pressure concern. There was a bleeding risk if you're on certain medications, and then drowsiness. So it was not appropriate for a lone treatment of moderate to severe depression. So no, this isn't permission to quit your medications. Start seasoning your feelings. It is proof that sometimes science looks at your spice rack and says, yeah, that one stays.